Hey guys, welcome back to the channel. If you're watching this, there's a good chance you're dealing with things like slow urine flow, frequent bathroom trips especially at night maybe, even that annoying dribble after you've already finished peeing. Some of you might be experiencing leakage, urgency, or feeling like you can't fully empty your bladder. And yeah, it's frustrating. Let me tell you this, you're not alone. These symptoms are incredibly common, especially for men over 50. And while a lot of people will tell you this is just part of getting older, I'm here to tell you there's a lot you can do about it. Now before we go further, I am a physical therapist who has worked with hundreds of men around the world to manage symptoms of BPH. That's the medical name for an enlarged prostate. It's not cancer, it's not life-threatening, but it can seriously mess with your quality of life. And the good news is that there are natural, non-invasive strategies that can help you reduce your symptoms and, in many cases, support the health of your prostate over time without jumping straight into surgery or medication. That's what today's video is about. We're going deep into what actually works. This is a practical It's not a magic pill, it's not a quick fix, but it is something you can start today. Now if you're new here, go ahead and hit that subscribe button. This channel is dedicated to men's health, especially prostate health, and I don't hold back. If you've watched more than one video here, we've got a deal. It's called the Gentleman's Agreement. You subscribe, you comment Gentleman's Agreement below, and I'll personally welcome you to the community. Alright, let's start by understanding what's happening inside your body. The prostate is a walnut-sized gland located just below your bladder. It surrounds the urethra, which is the tube that carries urine out of your body. As we age, the prostate tends to grow. For some men, it grows slowly and causes no issues. For others, that growth puts pressure on the urethra, narrowing the passage and making it harder to urinate. That's when the symptoms start. Weak stream, frequent urges, feeling like you didn't fully empty your bladder, needing to pee multiple times at night, and post-urination dribble. Not only is it inconvenient, it's embarrassing and exhausting. You might have been told surgery is your only option. Procedures like TURP, green light laser therapy, or RESER. And yes, those treatments work for some people, but they're expensive, they're invasive, and they come with risks like urinary incontinence, retrograde ejaculation, or even erectile dysfunction in some cases. What's often not talked about is that for many men, those procedures could be avoided with some key lifestyle changes. First things first, you need to know your baseline. That means visiting your doctor and finding out exactly how large your prostate is. That'll usually be measured in cubic centimeters. You'll also want a PSA blood test and a proper physical exam. Yes, that means the rectal exam. Is it fun? No. Is it necessary? Yes. You've got to know what you're working with. Once you've done that, you can start taking action. The first goal is to manage your symptoms. Even if your prostate is still enlarged, you can improve your quality of life by reducing how those symptoms affect you. One simple thing you can start doing today is called double void. It means you go pee, take a short break, maybe 15 to 30 seconds, and then try to go again. This gives your bladder more time to empty completely. It is especially helpful for reducing that post-pee dribble or the constant feeling that you need to go again 5 minutes later. Another thing, sit down to pee. I know, it sounds weird or maybe even unmanly, but it helps. Sitting relaxes the pelvic muscles and helps many men empty their bladder more thoroughly. Now, speaking of muscles, your pelvic floor is key. Strengthening your pelvic floor through proper Kegel exercises can improve urine control and bladder efficiency. But here's the catch: if those muscles are too tight, doing Kegels alone might make things worse. That's why you also need to stretch them. A good plan includes both strengthening and stretching. Do your Kegels daily. Start with 10 repetitions, holding each one for a few seconds, and add in gentle pelvic floor stretches before bed. Think of it as your nighttime recovery routine. Let's move on to diet. This is huge. Most of the inflammation in your body, including in your prostate, is coming from what you eat. Sugary drinks, processed foods, fried snacks, dairy overloaded, all contributes. You need to shift to an anti-inflammatory diet. That means cutting out added sugars, processed meats, and refined carbs. Start eating more vegetables, fruits, whole grains, nuts, and healthy fats like olive oil. Cruciferous vegetables like broccoli, cabbage, and kale have been linked to improved prostate health. Tomatoes are rich in lycopene, which has been studied for its potential role in reducing prostate inflammation. And yes, limit alcohol, limit caffeine. These irritate the bladder and make symptoms worse. If you're drinking several cups of coffee or cans of soda every day, start cutting back. Now let's talk about fluids. A lot of men don't realize that what they drink directly affects their bladder's behavior. Caffeine is a stimulant. It makes the bladder contract and increases urgency. Alcohol acts as a diuretic. It increases urine production. Artificial sweeteners can irritate the bladder lining. So what should you drink? Water, lots of it. Stay hydrated but space it out through the day. And avoid drinking fluids 2 hours before bed to reduce nighttime bathroom trips. Exercise is another major player here. Studies show that men who engage in regular physical activity have fewer BPH symptoms. Aim for at least 30 minutes of movement 5 days a week. This can include brisk walking, cycling, swimming, or bodyweight exercises. 3 days of cardio and 2 days of strength training is a great balance. And let's be honest, if you're carrying extra weight, especially around your midsection, your symptoms are going to be worse. Losing even a small amount of belly fat can reduce pressure on your bladder and improve urination. Next up, now, these are not magic pills, but some have real science behind them. Saw palmetto, beta-sitosterol. Look for reputable brands, and remember, consistency is key. It may take 1 to 2 months to notice any changes. Always talk to your doctor before starting anything new. Now, I want to emphasize something important. You need to be patient. These changes won't transform your life in a week, but over 3 to 6 months, you can absolutely see real results. Track your progress, write down your symptoms, note how often you pee, and how you feel each day. Be consistent, and you will start to notice a difference. Let me quickly recap your holistic game plan. 1. Get your prostate measured and tested. 2. Use double voiding every time you urinate. 3. Practice Kegel exercises and pelvic floor stretching. 4. Eat an anti-inflammatory diet, cut sugar and processed foods. 5. Reduce caffeine and alcohol, and hydrate wisely. 6. Exercise 5 days a week, mix cardio and strength. 7. Consider proven supplements to support prostate health. This is how you take back control naturally and intelligently. If you've made it this far, you're serious about your health, and I respect that. Let's make a deal. If this video helped you, click the like button right now. It helps this video reach more men who need this information. Subscribe to the channel if you haven't already. We post new videos on men's health every week. And Dan T, forget to drop a comment saying gentleman's agreement so I can welcome you personally. The more of us who talk about this, the more awareness we create, and the more men we help. You don't have to accept these symptoms. You don't have to suffer in silence. You've got options. You've got a plan now. Thanks for watching. Take care of yourself, and I'll see you in the next video.